Examination with the help of stethoscope is called. Options are A. Percussion, B. Palpation, C. Auscultation, D. Inspection. The answer is C. Auscultation. Drug used to treat bradycardia. Options are A. Morphine, B. Sodium nitroprusside, C. Verapamil, D. Atropine. The answer is D. Atropine. The position used to treat shock and decreased blood pressure. Options are A. Lithotomy position, B. Genupectoral position, C. Dorsal recumbent position, D. Trendelenburg position. The answer is D. Trendelenburg position. Anasarca is. Options are A. Generalized malaise, B. Periorbital edema, C. Pitting edema, D. Generalized edema. The answer is D. Generalized edema. Reflex elicited by stroking the sole of the foot with a sharp instrument. The answer is A. Patellar reflex, B. Achilles reflex, C. Triceps reflex, D. Plantar reflex. The answer is D. Plantar reflex. An ototoxic drug. Options are A. Aspirin, B. Digoxin, C. Chlorpromazine, D. Dapsone. The answer is A. Aspirin. There are other drugs which can cause ototoxicity, and aspirin is one among it. The second heart sound is due to closure of. Options are A. Aortic valve, B. Mitral valve, C. Tricuspid valve, D. Foramen ovale. The answer is A. Aortic valve. The first sound S1 and the S2 can be heard lub and dub. The S1, the first heart sound, is due to the closure of tricuspid and mitral valve, that is AV valves. The S2 is due to the closure of aortic and pulmonic valve, that is the seminular valves. Full volume but rapidly collapsing pulse. Options are A. Bounding pulse, B. Bigeminal pulse, C. Waterhammer pulse, D. Dichotic pulse. The answer is C. Waterhammer pulse, which is otherwise known as collapsing pulse, usually associated with aortic regurgitation. Sign of hypocalcemia. Options are A. Cullen sign, B. Homan sign, C. Goodell sign, D. Trouser sign. The answer is D. Trouser sign. So how do you elicit it? You can elicit it by inflating a blood pressure cuff on the arm, and you can see a carpopedal spasm, that is an involuntary contraction of the wrist and the hand muscle. So which indicate a low calcium level, that is hypocalcemia in the blood. The valve that lies between right atrium and right ventricle. Options are A. Tricuspid valve, B. Bicuspid valve, C. Mitral valve, D. Aortic valve. The answer is A. Tricuspid valve. So how do you remember this? In the right, it's tri. So you remember like ri and tri. Right side, tricuspid. Left side, bicuspid valve. Absence of recognizable QRS complex in ECG indicates. Options are A. Atrial fibrillation, B. Ventricular fibrillation, C. Sinus arrhythmias, D. Paroxysmal ventricular tachycardia. The answer is B. Ventricular fibrillation. Human albumin is an example of. Options are A. Crystalloid, B. Amino acid solution, C. Colloid solution, D. Fat emulsion. The answer is C. Colloid solution. Stimulation of alpha adrenergic receptors produces. Options are A. Vasodilation, B. Increased heart rate, C. Increased myocardial contractility, D. Vasoconstriction. The answer is D. Vasoconstriction. Infection with group A beta hemolytic streptococci is associated with. Options are A. Hepatitis, B. Rheumatoid arthritis, C. Rheumatic fever, D. Meningitis. The answer is C. Rheumatic fever. Deficiency of clotting factor 9 leads to. Options are A. Hemophilia, B. Thrombocytopenia, C. Christmas disease, D. Thalassemia. The answer is C. Christmas disease. So the deficiency of factor 9 is otherwise known as Christmas disease or hemophilia B, and the classic deficiency of factor 8 is known as hemophilia A. The following parameter should be monitored in patients after heart valve replacement. Options are A. Prothrombin time, B. Clotting time, C. Bleeding time, D. Platelet count. The answer is A. Prothrombin time. Scheduled dose of digoxin is withheld and notify physician when the adult patient's pulse rate drop below. Options are A. 50 beats per minute, B. 60 beats per minute, C. 70 beats per minute, D. 80 beats per minute. The answer is B. 60 beats per minute. Digoxin, when you give, the very important thing is that you have to see a full minute pulse. If it is below 60, hold the medication because digoxin itself will cause bradycardia. When the pulse rate is less than 60 beats per minute, it is called. Options are A. Bradycardia, B. Bradypnea, C. Tachycardia, D. Tachypnea. The answer is A. Bradycardia. Nitroglycerin is given sublingually to relieve pain by vasodilation of. Options are A. Pulmonary artery, B. Coronary artery, C. Aortic artery, D. Carotid artery. The answer is B. Coronary artery. The most common cause of heart disease in adolescents or young adult is. Options are A. Rheumatic fever, B. Congenital heart disease, C. Anemia, D. CCF. The answer is A. Rheumatic fever. Pressure exerted by plasma protein is called. Options are A. Hydrostatic pressure, B. Filtration pressure, C. Systolic blood pressure, D. Oncotic pressure. The answer is D. Oncotic pressure. Right ventricular enlargement due to pulmonary problem is called. Options are A. Cardiac tamponade, B. Cor-pulmonale, C. Cardiomyopathy, D. Emphysema. The answer is B. Cor-pulmonale. An antifungal agent. Options are A. Amphotericin B, B. Adenosine, C. Adriamycin, D. Amantadine. The answer is A. Amphotericin B. Which part of the heart is responsible for circulating blood through the lungs? The options are A. Left ventricle, B. Right ventricle, C. Left atrium, D. Right atrium. The answer is B. Right ventricle. Function of vitamin K is. Options are A. Helps in wound healing, B. Helps in formation of healthy bones and teeth, C. Helps for clotting of blood, D. Helps in calcium absorption from the intestine. The answer is C. Helps for clotting of blood. The longest vein in the body is. Options are A. Femoral vein, B. Cephalic vein, C. Long saphenous vein, D. Umbilical vein. The answer is C. Long saphenous vein. Which of the following drug is to be infused fast? Options are A. Aminophylline, B. Mannitol, C. Dopamine, D. Potassium chloride. The answer is B. Mannitol. The most important electrolyte of intracellular fluid is. Options are A. Sodium, B. Potassium, C. Chloride, D. Calcium. The answer is B. Potassium. Hypotension in postoperative period leads to. Options are A. Hypoxia, B. Hypovolemia, C. Cardiac arrhythmias, D. TAO. The answer is C. Cardiac arrhythmias. Normal CVP, central venous pressure, is. Options are A. 5 to 6 millimeters of mercury, B. 2 to 8 millimeters of mercury, C. 10 to 12 millimeters of mercury, D. 1 to 3 millimeters of mercury. The answer is B. 2 to 8 millimeters of mercury. Yes. So if you are a nurse who wish to attend the licensure examinations like Prometric, HAAD, DHA, etc., we provide 40 hours live online classes. For more information, you can WhatsApp to the number which you can see on the screen. If you find the video useful, please like, share it with your nursing friends, and subscribe the channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.